NUCALA is a prescription medicine used with other medicines for the treatment of adults with eosinophilic granulomatosis with polyangiitis, EGPA. Do not use NUCALA if you are allergic to mepolizumab or any of the ingredients in NUCALA. Remember to watch the full video for additional safety information.
I've known I wanted to be a sports broadcaster since I was about 10 years old. I think for me, being so little, it was just seeing the sports on TV was almost like this different world, like another realm you're in. I always found that play-by-play, the whole art of commentating the game, it almost became this sort of weird obsession. It's kind of how I ended up getting into that passion and that desire to go into the side of broadcasting that I'm in today. I went to a school that specialized in broadcasting. The first year and a half to a couple of years were really amazing. Toward the end of my sophomore year, I started getting some weird shortness of breath. It definitely took me by surprise, and it expanded from having some coughing to all of a sudden some asthma-like symptoms. I ended up seeing a doctor, and they started me on steroids along with an emergency inhaler in case I needed it. A lot of the asthma attacks I was getting started almost picking up to the point of kind of like a helpless combination of shortness of breath, coughing, along with this really constricted feeling I had, where I just didn't really feel like I had much air that I could push out. It would get to the point where I had to go to the ER and basically get emergency nebulizer treatment. I was still in the midst of trying to start this whole broadcasting career, the thing I had such a passion for, and it got to the point where I would have asthma attacks while I was on the air, which was such a frightening thing to have happen. That's when I really started worrying, just from the standpoint of how am I ever gonna deal with this? I started to get this abdominal pain. Then I started having numbness in my hands and my feet. I started getting these beet red rashes all over my arms and legs and on my hands, to the point where it was really hard. I couldn't even hold a cup in my hand to drink out of. The rest of my team of doctors were able to combine those with a lot of the different tests. I finally got the diagnosis of EGPA. For me and my path to diagnosis, I think what I learned the most is that communication is the factor that really speeds up this process a lot. And I felt fortunate that it worked out the way it did, getting the diagnosis when I got it. At the time, there were no FDA-approved methods to specifically treat EGPA. My doctors in that case pretty much said, you're going to have to take a lot of steroid drugs and you aren't going to feel very good, especially in this initial stage post-diagnosis. There really weren't any alternatives though. Those medications kept me really alive through my senior year, even if I felt run down and kind of queasy a lot of the time. One day, my parents came to me. They had heard about a new potential treatment for EGPA that was being looked at by the FDA. Fortunately for me, the drug was approved as NUCALA, and I was able to essentially add it on to my existing regimen of drugs at the time. After being on NUCALA for a few months, I could definitely start to notice that I wasn't having as many issues with shortness of breath or breathing. Over a 9-month period of taking NUCALA, I was able to work with my team of doctors and taper my steroids all the way down to a point where I eventually didn't have to take them anymore. To be done with steroids at that point was a big deal for me. Fatigue is something I still do deal with, but it's something that I've just come to accept. This has been my experience, of course. It could be different for other people. Getting a diagnosis early is so massive. Being able to have that answer and being able to focus on one thing to find a treatment that works for you is such a big part of this whole process. At this point now, I'm in a relatively new city, just moved to Las Vegas. What's nice now is that I really haven't had any sort of EGPA flares. I don't really think about my disease on a daily basis. To me, the NUCALA auto-injector has made life a lot easier when it comes to the logistics. It might seem like just a casual thing, but for a patient, when you deal with a lot of the logistics, it's a really big deal. I can really focus on my career and broadcasting, and that has really taken the forefront of my thinking as opposed to my disease.
Conference play is heating up, and this afternoon it's a matchup of top 25 teams in Las Vegas.
NUCALA is a prescription medicine used with other medicines for the treatment of adults with eosinophilic granulomatosis with polyangiitis, EGPA. Do not use NUCALA if you are allergic to mepolizumab or any of the ingredients in NUCALA. NUCALA can cause serious side effects, including allergic hypersensitivity reactions, including anaphylaxis. Serious allergic reactions can happen after you get your injection of NUCALA. Allergic reactions can sometimes happen hours or days after you get a dose of NUCALA. Tell your healthcare provider or get emergency help right away if you have any of the following symptoms of an allergic reaction: swelling of your face, mouth, and tongue, breathing problems, fainting, dizziness, feeling lightheaded, low blood pressure, rash, hives. Herpes zoster infections that can cause shingles have happened in people who received NUCALA. Before receiving NUCALA, tell your healthcare provider about all of your medical conditions, including if you are taking oral or inhaled corticosteroid medicines. Do not stop taking your other medicines, including your corticosteroid medicines, unless instructed by your healthcare provider, because this may cause other symptoms to come back. Have a parasitic Helminth infection. Are pregnant or plan to become pregnant. It is not known if NUCALA may harm your unborn baby. Are breastfeeding or plan to breastfeed. You and your healthcare provider should decide if you will use NUCALA and breastfeed. You should not do both without talking with your healthcare provider first. Are taking prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of NUCALA include headache, injection site reactions, pain, redness, swelling, itching, or a burning feeling at the injection site, back pain, and weakness, fatigue. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.